Hi, Alex here from Fertility Acupuncture blog. I'm in Brisbane this weekend for a really interesting seminar by a woman by the name of Deborah Betts, and she wrote a great book about obstetric acupuncture. Now, I suppose for a lot of you there's going to be a leap from fertility to obstetrics in terms of treatment, but it's when we talk about obstetric acupuncture or obstetric Chinese medicine, which is one of the areas that we specialise in our clinic, fertility is very much an important part of that particular branch of Chinese medicine. So when we look at fertility, or when we look at women's health, and when we look at trying to have a baby, trying to have a family, we really look at it in several stages. Fertility is not the only aspect, although obviously falling pregnant is important. So I think we try and break it into several components. The first one is preconception care, and preconception care is that fertility part of the cycle. Now, whether you've been trying for a while and haven't had the success that you'd hoped for, or whether you're about to embark on the journey to parenthood, or whether indeed you're going through some form of IVF or other assisted reproductive technology, thinking about children as a more thorough process is really important. And I think part of that is being able to visualize and see the end process. And one of my favorite authors, Stephen Covey, would write that when you were looking at your life, when you were planning the things that you would like to achieve, then bearing the end in mind, or keeping the end in mind, is really important. So keeping that long-term vision or that goal is really important, even when you're just embarking on that fertility process. So anyway, Deborah Betts started off as a nurse, has been an acupuncturist for many years, and is doing some really interesting research, specifically in recurrent miscarriage or threatened miscarriage. So there's a lot of information here that is really, really important and pertinent to not only falling pregnant, but what do you do once you are pregnant. And the thing that is most jumped out to me at this seminar, most of all, is how critical supportive care is in that first 12 weeks of any pregnancy. And there are some quite incredible statistics, and I can't remember off the top of my head. I'll put them on the blog when I get back to Canberra. But there are several interesting studies that have two groups of women. One group who are supported on a weekly basis throughout the first trimester of their pregnancy. So a weekly visit, they're given advice in terms of meditation and diet and lifestyle, what to do, what not to do, and they're really supported every step of the way. And then the second group are basically told, by their GP or their medical carer to go home and not worry about it. And this particular study focused on women who'd had at least 3 miscarriages. So it was a particular cohort of women from a fertility perspective who were trying to fall pregnant and who had indeed fallen pregnant, either through IVF or naturally. I'm not sure that was an important factor. But the important part is that supportive care throughout that first 3 months of pregnancy was incredibly vital. And as I said, I can't remember the exact statistics, but something like 50 to 56% of those women went on to have really good birth outcomes, and a much lower percentage of women who didn't have the supportive care went on to have further miscarriages. So that supportive care in that first trimester seems incredibly important, and that's one reason why at our clinic we really focus on that first trimester. And it's interesting, you don't always know what's happening. Is it the acupuncture points we're using? Is it the environment? Is it a combination of what combination of things is reducing the rate of miscarriage in early pregnancy? Because there's no doubt from our clinical results that women who do or since we've been doing that supportive care throughout that first trimester have had much lower rates of miscarriage. So this research further supports the benefit or the value of that in terms of particularly women who've had recurrent miscarriage. But I think that it's important for any pregnancy to have that supportive care model throughout the whole of the first part of the pregnancy, from week 1 more or less through to week 12, and that's incredibly important. So if you're interested, jump online, look up Deborah Betts. She's actually from New Zealand, really interesting, smart and intelligent lady, and she's doing some great work. So if you're interested in fertility, if you're interested in obstetric acupuncture or Chinese medicine treatment, then she's definitely worth looking up. Okay, bye for now.